The reality is that the vast majority of patients with many of the conditions where we work are not actively involved with patient advocacy groups. There's large communities of what I call the unaffiliated patient populations. The people who are out there talking to one another in social media, who are engaging in a number of different ways. And we need to be able to tap into that, to learn and to listen. And frankly, those are the people oftentimes who don't have the time or the privilege to be able to be actively involved with patient advocacy groups, but those are our customers. And so we need to know and understand what are their needs. And then lastly, there's the fact that we all generate data in any number of ways. So when patients are interacting with the healthcare system, when they're talking to one another on social media, we are all generating data. And so the way that I think about it is when you come down to the individual patient level, there's a real granularity of the data and the insights. And when you go up to the large data sets, there's a generalizability. So you can say, yes, I know how this is impacting large numbers of people. And so when we need to work on patient insights, you need to work at all levels to be able to say, yes, we are engaging the individual patients, we're also looking at the data, we're also working with the patient advocacy groups, and we're also looking at what I call the unaffiliated patient populations who can come in any number of ways. And if anyone says that they are doing any one of these and they think that they have adequate patient input, it is not appropriate. What you need to do is to be able to work at all levels. So I just want to spend a little bit of time, and I know that we have talked about within the context of this conference the term patient engagement, and so I just wanted to make sure, because there's a lot of terms that are being used with the term patient, and I find now as the chief patient officer, anything with the word patient ends up on my desk, and so I want to be clear what it is that we're talking about as we talk about these different terms. So for me, patient centricity is this concept of making sure that all of our work really focuses on the patient and improving patient outcomes. And we have had situations where you will have, for example, in the early days of the patient-centered medical home, patients were not involved with that. And so having that patient focus is very, very important in terms of our thinking, but it is not an action. One of the actions is patient engagement, and that is bringing patients in as partners. And I think that patient engagement is an important way to get towards patient centricity, but patient engagement is not patient centricity. Patient engagement is a means towards an end, which is to make sure that that engagement then translates to an improvement in patient outcomes.